Welcome to Hope in the Face of Cancer, where we share real stories of courageous people and their cancer journey. Today, we are thrilled to welcome Dorothy Gibbons, the co-founder and CEO of The Rose, a center of breast health excellence. Since its launch in 1986, The Rose has served nearly 1 million patients and is now the leading nonprofit breast health organization in Southeast Texas. Dorothy is a fierce advocate for women's health, ensuring that every woman has access to life-saving mammograms, diagnostic services, and treatment. She's here today to share her story, discuss the mission of The Rose, and offer insights on how we can all contribute to better health outcomes. Dorothy, it's a privilege to have you here today. Welcome to Hope in the Face of Cancer.
Oh my goodness, it's an honor to be with you, Darcy.
Oh, and I love your pink. It's fantastic. It looks great.
Thank you. We have a lot of pink.
We do. I'm sure your closet is very well outfitted in pink. So many of our listeners, we have listeners all around the country and even around the world, and they may not be familiar with The Rose. So can you start out by just sharing a little bit about the organization and what services it provides?
Yeah, The Rose is a nonprofit breast cancer organization, but we provide direct services. And that includes mammograms and ultrasounds and diagnostic workups and biopsies and physician consults. And we serve both insured and uninsured women. Now, the important part of The Rose and what our mission is all wrapped around is that when that uninsured woman is diagnosed with breast cancer, then we find ways to get them into treatment. And that is, there's no reason for us to screen anyone if we can't get them into treatment.
Yeah.
We serve about 40,000 women a year. We do it through, and men, women and men.
Yes.
We do it through our 2 diagnostic centers, which are Houston-based, and through our 5 mobile mammography coaches, which cover 43 counties in Southeast Texas. So this is a local organization serving local, but also regionally, and many of our programs have been replicated in other cities.
Oh, it's truly incredible what you've accomplished since you founded the organization. And I would love to go back and let's kind of rewind 39 years. Tell us about how The Rose got started, your initial vision, because what you've created is so phenomenal. I would imagine it's been quite the journey, but what prompted this 39 years ago?
Darcy, I'm going to tell you, there was no initial vision. There was no
an initial passion.
I had these ideas that I would ever be in a nonprofit. I was working as the PR marketing person at Bayshore, at Pasadena Bayshore Hospital, which was the 10th largest hospital at the time, General Hospital.
Yeah.
I did all the regular kind of things. And in 1983, Dr. Dixie Malillo came on board. She was our first female doctor to be on staff. Now you got to remember, 83.
Yeah, 83, yeah.
And only like 3% of all the women who graduated as physicians were or all the physicians that graduated were women, and almost none that were general surgeons.
Yeah.
And the hospital setting, that general surgeon rules the roost. And here we had this female who was drop dead good looking and had a
shaking things up.
She had such a personality. You wouldn't believe it. She never went anywhere without her lipstick. It was, she was like 5'7", wore 3-inch heels, and when she walked down the hall, everybody turned. But the thing was, she had this incredible passion about breast cancer, and she had been the primary resident in the Galveston Breast Health Center, so she saw all kinds of breast cancer. She convinced our administrator that we needed a dedicated breast center. And that was kind of where some of this started. But the thing you have to know is Dixie never went anywhere alone. She drugged me to everything. Usually I was the driver because she hated driving in Houston, and we did all these educational talks, and we were, we thought we were really doing something. But at one of these meetings, she drugged me to a conference where Rose Kushner was one of the speakers.
Okay.
Rose Kushner was a journalist for the Baltimore Sun. She was the first female journalist to cover Vietnam.
Wow.
She stood about 5 feet tall, very proud of her Jewish heritage, and had a mouth on her that would embarrass anyone. So when she found the lump in her breast in 1979, her doctor said, "Oh, Rose, don't worry about this. Women are always getting lumps in their breast, and we'll just go ahead and do your biopsy. And if it is malignant, we'll come out and tell your husband, Harvey." Now, this is Rose Kushner. She said, "What do you mean you're going to come out and tell my husband, Harvey? Then what do you do?" And they said, "Well, then we'll do your mastectomy." She said, "No, I'm
Do I have a say in this?
Yeah, I'm going to make this decision. I'm going to decide what you do with my boobs." And I mean, it was like that.
Good for her.
She knew better. Well, it was 16 surgeons later. Can you imagine that happening? 16 surgeons later before she found someone that would wake her up, tell her the results, and let her make the decision about her breast. Now, of course, it was malignant.
Yeah.
And in a journalist frame of mind, she went to work at Educating Women, wrote an incredible book that was in lay people's understanding language. And it had to be called Alternatives, because when she put the word breast in its title to begin with, it never saw the light of day. It stayed in the back rooms of bookstores.
Hush, hush, don't talk about it. Yeah.
Yes. I had read the book. She was a hero. I just thought, my gosh, look at all she's doing. And she was going to be on this panel. So I wrote her a letter, remember, to our young listeners. This was before email.
Yeah.
I wrote her a letter and I said, "Dear Rose, would you please have coffee with us? Dr. Malillo and I would love to talk to you about what we're doing in Houston, Texas." Well, she wrote back and said, "I have a dinner. I have a evening open. Let's have dinner together." And I went, "Oh my gosh, I'm going to have dinner with Rose Kushner." Oh, I was so excited. So we get to dinner, and there's Harvey and Rose and Dixie and me. And Dixie is in her best suit, and she is, remember, she's a general surgeon. She has a lot of presence.
Yeah.
And so she's going on and on about all this education we're doing in the Houston community, all the speeches we've done, all the talks. And then Rose kind of leaned into her space. You don't do that with doctors. Leaned into her space and said, "Well, tell me, Dixie, after you do all that educating, what are you doing with those women?" And Dixie said, "Well, that's a problem. Right now we're seeing so many uninsured. You have to remember, in the mid-'80s, this was the time of the oil bust.
Yeah.
There were more foreclosures during those 3-4 years than ever in Texas history. Wow. People were losing their jobs. They were losing their insurance. They did not know how they were going to live. So we were seeing a lot of late stage advanced breast cancer that had already erupted through the skin. Wow. And for those women, there was no hope.
Yeah.
So anyway, so Dixie said, "Well, that's just it. We have so many uninsured, and we have no one that'll take them. I keep trying to get the hospital to do free care." Well, at that point, Rose really leaned into her space and said, "Dixie, quit your pissing and moaning and get off your duff we use in public." That's not what she said. "And go start yourself a nonprofit." Wow. Well, Darcy, I guarantee you, neither one of us had that in mind.
Right.
I was on HCA's faculty. I saw myself going up that little ladder. Yeah. Dixie was a general surgeon doing all kinds of surgeries, starting her practice. This was not something we were going to do. Unfortunately, or fortunately, Rose called me every Friday. "What have you done about your nonprofit?" Nothing.
Oh, wow. Talk about an accountability partner. You didn't ask
What congressman, because there were no women then, what congressman have you called to get this Medicare bill passed? "I know a congressperson. Wow. What are you talking about?" So every Friday I had to come up with some excuse. Of course, I was working full time. We were still doing all our talks.
Yeah.
And But finally, I gave in. I wrote the application for a nonprofit status. We had our approval in 7 days.
Wow.
That doesn't happen.
Unheard of. Yeah. It's meant
So
to be.
I wrote Rose another letter, and I said, Rose, we've got our nonprofit status now, and we've decided to call this place The Rose as a living tribute to you. Now, what you need to know is my maiden name was Rose. Dixie's married name at the time was Rose, and we had met Rose Kushner.
Wow.
Now, what were we going to call this place?
Yes. That's amazing.
So, of course, Rose being Rose, picked up the phone, called me once she got the letter and said, what the hell do I need a living tribute for? Oh, this woman. You know, she died before she got to see either of our centers. And Harvey, her husband, always told me that whenever she had a chance, she would talk about a place in Houston, Texas that was doing what they could to take care of the uninsured. And I know she would have been proud of it.
Absolutely.
But that's how we got started. You know, of course, now we had our nonprofit status. And of course, then we had to raise money, right?
Yeah.
So the way that we raised money for the Rose to open it up was through a bachelor's auction.
Oh, my goodness.
We sold men to make money for cancer.
You got to do what you got to do
today. We made a whole $7,000. Dixie brought her ex, sold him. We had every doctor that was single, sold all them. But that $7,000 and a donated mammography machine, which was top of the line. That's how we got started. That's how we opened our place. We paid $3 for each insured lady that walked through our doors, and our uninsured women, you know, they didn't have a charge. So our rent went off what we served in our insured women. Wow. $3 for each woman. So
that
that's
is
how
incredible. That is incredible. I mean, the things that you had to go through to get that started, and even your own reticence. I mean, I'm so glad for her, you know, pushing you in that direction to get it off the ground. Tell us about those early years. And
well, I stayed working at the hospital for a while. Mm-hmm. I volunteered. I did all the administrative. We had a great technologist who made sure we were all in line and did those kind of things. But you know, Dorothy, I love telling the story of Rose, because in everyone's life, you need a Rose.
Yes.
In everyone's life, you need one, or you need to be one. And I'm not sure that I've always stuck to that and been that person. But anytime I hear someone with a dream, I'm going to say to them, you go for it. Tell me how you're doing it. You can do it. If anyone had told me back then that, oh, there was no way we get it done, I still would have tried. But because she had such belief in us, then there was no way I could fail her.
Yeah. It makes me think about our survivor volunteers and the role that they play in the lives of people facing cancer. You know, it's sometimes they have to believe for our clients because they don't have the belief in themselves that they can get through this.
That gives me chills. Yes, absolutely. Wow. Well, when we opened our center, it was 915 square feet. Now I want you to envision that if you can.
Right. Yeah.
A little small. And our front desk folks were volunteers who were patients of Dr. Dixie's. They were both breast cancer survivors. One was a stage 4, told she would not live a year. She went on to live 12. Wow. You know, we always said we don't go by the statistics. We don't believe in those. And our only paid employee was our technologist for those first 4 or 5 years. And then finally, I received I wrote all the grants, of course, and all the other stuff like that. So
chief cook and bottle washer, right?
No, listen, we even had a washer dryer back then. You washed your gowns and things. I had a technologist once who was vacuuming and saying, I don't even do this at home. I mean, you know, it was, but
they believed in what you were doing.
Yeah, great. We were very grassroots, very hands-on. But it wasn't long before we had to keep growing, because in the beginning, MD Anderson would take most anyone that we thought had a problem. And then it became you had to prove they had a problem. So that meant we had to start doing biopsies. Things kind of changed. And it was really apparent to us from the get-go that we were going to need women who had the ability to pay or had insurance. You got to remember, back in 1985, 86, Medicare did not cover screening mammograms.
Yeah.
You had to pay that out of pocket. Back then it was $50 at the Rose. And we had, it's always been ironic to me that we're sitting in the shadow of the medical center.
That's
and
right.
Still the Rose is needed. If anyone had said to me back then, well, where do you think you're going to be in 38, 40 years? I would have said, cancer there'll be a cure for cancer. And there won't be a need for the Rose anymore because we'll have a better way to handle the uninsured and the poor parts of our community. But that hadn't happened.
Yeah.
And, the story's always the same. The women are working, but they don't make enough for private insurance, and they're working for someone who just doesn't offer the employer insurance coverage.
Yeah.
So
you're a lifeline.
None of that has changed since those early days.
How has your mission evolved over the last 39 years?
I think in many ways our patient navigation program has been the hallmark of the Rose. And these are the people who get patients into treatment ultimately. But they're also every single person who's navigating that. We call our uninsured patients sponsored because every single patient has to be sponsored by somebody, a grant, an individual, something, in order to receive a service. So, all of our systems are set up for that, to move that sponsored woman through. And unfortunately, I don't know many people that haven't at some time in their life been without insurance. And I think my staff particularly is very aware of what can happen when a woman doesn't have that access. So we've evolved, certainly technology-wise and certainly services-wise, but I think our basic premise that we don't want anyone to die from breast cancer because she can't afford a mammogram it continues.
Yeah. Well, I've met some of your team. They are absolutely incredible. And you can tell that they have such a heart for what they're doing.
Thank you.
It's amazing. I can only imagine the hundreds, if not thousands, of stories in the back of your mind that you've collected over the last 39 years. Can you share a story or two with us that have been most impactful to you?
I can tell you a story that actually started patient navigation.
Yeah.
And it was from a young woman named Jerry who called me from a phone booth.
Oh, my goodness.
And when I answered, I have like maybe 8 employees at this point. When I answered, of course, I answered calls all day long. But she said, "Is this the Rose?" And I said, "Yes." And she said, "Oh, I'm so glad this was my last quarter."
Oh.
She's standing in a phone booth using her quarters. And she said, "I was lucky there was a phone book here." And then she starts to tell me her story about how she'd found a lump in her breast. She's 39 years old. She has a 9-year-old son. Her husband works. She works part-time. But when she found the lump in her breast, she went to a place and they told her, "You need to have a biopsy. You need to have more tests." She said, "So we used all our savings. We didn't have a credit card." And they got through the biopsy, and then she had cancer. And this whole time I'm thinking, she's calling me from a phone booth. What's the chances we're going to get disconnected?
Yes.
And then I was thinking, all the things that she's told me that she somehow borrowed or found the money for, we could have helped her with.
Yes.
And now she has cancer. And she said, and so today my drains are still in, and I went to my surgeon for a checkup. And she said, he's letting us pay it out. And then she said, and he told me I needed to go talk to the oncologist. And I said, you mean oncologist? She said, yeah. She never mispronounced it again.
Wow.
And she said, so he took me down the hall to this oncologist, and he was looking at my chart. And he said, well, you're going to need chemotherapy right away. We've got to start this week. And she said to him, how much is that going to cost? Because I don't have insurance. He said, what do you mean you don't have insurance? She said, I don't have insurance. I'll have to find this money somewhere. And he handed her back her chart and said, go find another doctor. I can't help you. She took her chart, went downstairs, found a phone booth that had a phone book, and started calling around. And it was the American Cancer Society that said, you know, you might call the Rose. Mm. At that point, I said, Jerry, I got to have a phone number. We don't have a phone. I said, I've got to have a way to contact you.
Yeah.
Just in case. And then she said, I said, didn't you say your husband worked? He said, yeah, but he can't take calls. And I said, well, I've got to have a way. I think finally she gave me that. This has been a long time ago, Darcy, but I still remember what her voice sounds like.
Yeah.
And then I said, okay, well, let me see what I can do. Do not hang up. Even if I don't come right back on, stay on this line. And I'm literally throwing a pencil across the hall to my other employee that's administration there, saying, please get me Dr. Nancy Neff's phone number. And she was someone that we'd worked with, someone that helped get our patients into Ben Taub. Nancy talked to me and then made it to where she could talk to the patient, made sure that patient had that number. And she was having her, she started her chemo that week. The next week was Thanksgiving. And they were not going to have a Thanksgiving. And my team went together and took them Thanksgiving dinner. So I used Jerry's story in a grant proposal to the Episcopal Health Charities. That's what it was called then, before it became the Episcopal Health Foundation. And they are the ones who saw my vision. You know, I thought if you had a positive diagnosis and you had your slides with you, you know what I'm talking about.
Yeah.
You know, I could just send you to Harris Health and you'd get right on in. Well, that didn't happen. You needed someone to walk alongside you. Yeah. What if Jerry had not gotten to me? What if that last quarter had been used some other way?
Yeah.
You know, and so they helped start that program. I mean, at one time we had 500 physicians who were part of our physician network. And that was before we were part of the state program that does provide a program for uninsured if they have breast or cervical cancer. So, you know, those were the early days, but thank goodness for people like the Episcopal Charities who knew what we were up against.
Yeah, and saw what you were capable of accomplishing and the impact that you could have. That's incredible. I can imagine that story fuels you every single day and fuels others as well. So tell us a little bit about some of the challenges or obstacles that you faced over the last 39 years.
Well, I think awareness has always been one of the things. You know, I know if I have the privilege, opportunity to be on television, then they, you know, of course, they want to know about our uninsured program. Well, that leaves out this whole segment of the insured population that we need so much to just have our foundation, to just have our, you know, our basic revenue just to open the doors every morning. Yeah. And I think the other thing is that for so many of our women, they're not coming to us for screening. They're coming to us with a lump in their breast. They're coming to us needing more than a screening. You know, if I only did screening, Darcy, for every 3 insured women I serve, I could serve an uninsured.
Mm-hmm.
But it's the biopsies, it's the workups, it's the patient navigation to treatment. All of those things are why we have to raise this $5 million every year just to get them through. But, their options are so limited when they're coming to us at that stage.
Yeah.
On our mobile units, which only do screening, it's so fascinating to me because I can take the women who are diagnosed that are insured through our mobile and the ones that are uninsured, and side by side, they're the same stage. They've all got that same opportunity to have the advantages of early detection. Their options are the same. Their survival is the same.
Mm-hmm.
But not when we're catching it later.
Yeah.
The only stage 4 cancers we've diagnosed in the last 8 years have been in uninsured women.
Wow.
The only stage 4. Don't talk to me about the need for or the disparities that hit our healthcare system. I only have to look at that.
Yeah. So if you had a magic wand that you could wave, what would you change?
Well, sure. Certainly it would be that there'd be a cure. Certainly it would be that we would not even have to get there. That whatever we could do with our bodies, we wouldn't have cancer. I can't think of anything stronger than that. After that, I think of how many people are touched by cancer, no matter what type it is. And I just think that we forget cancer changes you.
Yes.
And that it doesn't, especially in breast cancer, finding it early is our only, that's it. When we find it early, we've got a chance. Find it late, we don't.
Right.
Dr. Dixie Malillo always says, don't be afraid of finding breast cancer, be afraid of finding it too late. So,
it's wise counsel.
Yeah.
And I would imagine that's what's driven you to be focused on better screening for young women. So talk a little bit about your passion around those under 40, especially being able to regularly get mammograms.
We diagnose 400 to 500 women every year.
Mm-hmm.
Half of those women are under the age of 45.
Wow.
Half. Every year we diagnose women in their 20s. Last week, I just interviewed someone that we diagnosed at age 18.
Oh my goodness.
Now, in our Black community, more women at age 30 to 35 develop triple negative breast cancer. And that's one you're not going to find easily. Right. And you're sure not going to cure it easily. So, if I had my magic wand, as you said, I would be doing an MRI on every woman that's in her 30s just to see what else we could find. Because that's when we could catch it. Our USPSTF, United States Preventive Services Task Force, recommends this year that women start at the age of 40 and have one every other year. I'm seeing women die way before they're 40.
Way before that.
And, I understand all the problems with screening. I get it. I've been doing this a long time. But still, if a woman can't say, I know something's different, and have that screening mammogram, it's the same barrier for the insured woman because a diagnostic mammogram is going to go against her deductible.
Yes.
And believe me, that's a big price. Who wants to go in for something that may not be nothing and, and spend that kind of money? It's a barrier anyway we go, insured or uninsured. But think about what we lose when that's not detected. There's just, it's insane.
So true. And you would hope that as the trends are getting younger and younger, it would free us to, eventually be able to make those recommendations younger and younger as well and get the
Darcy,
support.
you know this in healthcare.
Yeah.
It takes 10 years of gathering data and then another 10 years of studying it.
I know.
before you finally have a change. And then 7 years later, somebody will come up with something that changes it again.
That is true.
Yeah. The deal
That
is
is true.
we are women. We have certain, I truly believe this. Women know their bodies. They know when something isn't right. And nobody else is going to raise their hand and say, take me when the time comes. It's your body. You need to have a voice.
Yeah. Speak up, be your own advocate for sure.
That's it. That's one message I hear over and over in all our podcast guests and over in every situation that has to do with anything that is healthcare related. You must be your own advocate.
Yes. Amen. So you talked about how this wasn't necessarily in the plan for you. That you got pushed and shoved a little bit into it. And thank goodness you did, because 1 million women already have been impacted by what you've built here. But I'm curious about the lessons you've learned along the way, growing as a leader and as the CEO of this organization. What's a key leadership lesson that you've
Take
learned?
care of your people.
Mm.
They're the only ones who are going to do it.
That's right.
They're going to do the work. They're going to carry the mission. People don't see me. They don't know anything that I do, but they sure know how they're treated when they make that phone call or when they have that service. That's the number one.
Yeah, absolutely. Absolutely. You told us one very powerful story that I would imagine you draw on and keeps you going a lot. But what you're doing is hard, and there's a lot of barriers, and there's a lot of things outside of your control. So, kind of, what keeps you going and driving for reaching more people, for improving all the time? Kind of, what's keeping you going?
Darcy, it's just the people we serve.
Mm-hmm.
About an hour before this podcast, one of our sponsored ladies came in. She's gotten a job. She's going to be able to have insurance. She's so happy. I'm down in the lobby. We're hugging and kissing. I mean, you can't buy that kind of thing. Those are the feelings that get you out of bed in the morning.
That's right. That's right. Absolutely. No, it's wonderful that you get to see and touch those stories every day, because oftentimes as a leader, you get caught up in the administrative burden of the organization, and you have to stay grounded. Yeah,
I do too. And then I go walk through the waiting room. But it is hard, Darcy. I think every leader needs to have someone they can talk to.
Yeah.
I think every leader, because there's no one else that you can. Right. You've got to find someone beyond your board, beyond anyone associated with your organization, that you can say, wow, this was tough.
Yeah.
And even if it's just venting, to know that you're heard somewhere, that there's too many things that need fixing in our world, and we get to try one little tiny part of it. But boy, for us, it's our life. It's our life work.
Mm-hmm. Right. Everybody needs emotional support, and everyone needs that safe space that they can say whatever they need to say without being guarded.
Right.
Which is what we do every day for cancer patients. But I completely agree with you. It's not just unique to someone facing a medical issue. I think it's just life. You need that person, that lifeline that you can reach out to.
If we didn't learn anything through COVID, that was the one thing. Yeah. How much we miss each other.
What are you most proud of?
Oh, there's a lot of things, but I don't ever think that way, Darcy, honestly.
Yeah.
I always think, what else could I have done?
Mm.
And I know at the end of the day, a lot of times people say, what's going to be your legacy? I said, I've already done it.
Mm.
I only have to see one patient that lived to know, already done it. But I'm always proud of my employees, always proud of how they use their good judgment when we have a difficult case, and they always come through.
Yeah. So if not the legacy component, where would you like to see, I mean, it's been 39 years, where would you like to see the Rose in the next 39 years?
Oh, we've had dreams of having a Rose in every state and all those kind of things. And there's been some programs that have followed our patient navigation program. And the kind of things that we do through it. But honestly, Darcy, I kind of think this podcast that we started a couple of years ago, and I'm sure you feel the same, and it's called Let's Talk About Your Breast. But I'm sure that in some way it is reaching some of the people that I never could have hoped to reach.
That's right.
Can't provide that service, but maybe it'll inspire someone else, or maybe it will move someone to become that advocate for a patient. Whatever. I'm just totally amazed at this phase in my career, which obviously is in its end, getting closer to that time, but amazed that we could be doing something that could be so impactful. Thank goodness for this kind of technology. Thank goodness.
Absolutely. Yeah, something that we probably wouldn't have dreamed prior to COVID, but it, thrust us into, I think, a willingness to accept and rely on technology in a way that we never had before. And with that comes reach.
Oh, yes. Oh, yes.
No, that's
I think if we as leaders, whatever, we have to understand that we're going to take a risk every single day.
Yes.
So take a risk that matters.
Yes.
I mean, you may fall flat, and heavens knows, when I hear my old podcast, boy, did I fall flat a lot. But, and every time you're getting with someone, it's a different experience. But my gosh, take a risk. Life is too short.
Well, and
we both know
look what you're taking the risk for. It's worth it for that, even that one additional life that you impact, that it's worth it when you put it in that perspective.
Yeah, I guess so.
So CanCare and the Rose have been partners for years, and we've referred clients to one another, and we've got an emerging, even more budding partnership, but we focus on the emotional support side of the cancer journey. Talk about that from your perspective. Just the million people that you've served, the importance of that emotional support part of the cancer care journey.
Darcy, I'm sure you've seen this too. It used to be when we talk about support groups or, resources like that, people were very standoffish. And our women would say, I have my family, they're my support group. Or I have my friends, they're my support group. I am so grateful, not just that CanCare has also survived how many decades?
35 years,
during times when, and any way we look at this is mental health, when that was kind of a stigma if you needed something.
Right.
I'm so grateful that now we're not so afraid to say we need this kind of resource. And I mean, it from being a caregiver to being the patient, all of those roles take a ton to get through, and we all need someone there. So it was so interesting that before COVID, we had like 6 support groups that met. Some were very small, but they were different ages, different needs. And after COVID, the only one that survived was our Spanish-speaking one.
Wow.
And I thought, I have no reason, no way of knowing what that was. But I thought, it's so interesting. I'm sure a lot of our others found networks that they could be a part of, and so glad that that's possible. But boy, having that one-on-one support, there's just, I've always said we need a patient navigator for every disease. We need someone who knows about it, may not have been there, but at least knows what you're going to be facing. And those parts of our world that we really haven't spent a lot of time or money on, I think it's time we do that. We're worth it.
I agree.
We deserve it.
I agree. So as we are wrapping up here today, and we have listeners, some are survivors, some have just heard those words, you have cancer, some of our listeners are caregivers. What message would you like to leave with our listeners today?
I always think there's two things. One, I always encourage women, men, caregivers, you have to be the advocate. There's no one else out there. If you're caring for someone, you're going to have to be it. And that's a hard role to play.
Yeah.
I want to say to your listeners, loving yourself is probably the most important thing you can do during this time. And if that means you are selfish, or you don't get up and do what you used to do, or, you make somebody else do it, that's just fine. Loving yourself is the most important thing you can do.
That's very wise words. Thank you so much for that. And thank you for the blood, sweat, and tears that you've put in the last 39 years, and the impact and the legacy. I know you don't like to hear that word, but the legacy that you will leave for so many, not just in the breast cancer community, but just to show how you can get something done with some grit and tenacity and a really big heart.
Oh, thank you, Darcy. It's been like the blink of an eye.
I can only imagine. I know. What a blessing. What a blessing, though. Dorothy, thank you so much. Thank you for being a part of our show today.
Oh, thank you.
Thank you for joining us on this episode of Hope in the Face of Cancer, a survivor by your side. If you or someone you know is facing cancer or is supporting a loved one through their journey, we invite you to share this podcast. Thank you for your support in our efforts in the cancer community. No one should face cancer alone.